Call the member for Capella.
I rise today to speak on the Justice, Integrity and Community Safety Committee's Oversight Report on the Queensland Family and Child Commission. As a part of the oversight process, the committee reviewed the Queensland Family Child Commission Annual Report 2023-24, the Child Death Review Board Annual Report 2023-24, and held a public hearing with the Queensland Family Child Commission commissioners on the 13th of March 2025. The QFCC is responsible for promoting the safety and well-being of children and young people and improving Queensland's child protection system. The Child Death Review Board, which reviews the death of children connected to the child protection system, is hosted by the QFCC for administrative purposes. The QFCC reported a number of key achievements in its annual report that were noted to the committee. Of the note was the QFCC was featured in 2,385 media reports, which represented an increase of 293% from the previous year. The QFCC also completed 14 oversight reviews regarding statutory child protection systems and other systemic issues. Furthermore, the Commission published 10 reports and insight papers on a variety of topics, including young people, absenteeism from the care placements, and how Queensland is upholding the rights of children. The QFCC is also responsible for maintaining the Queensland Child Death Register. This register records the deaths of all children and young people in Queensland. Preliminary data from the QFCC indicates there was a decrease in child deaths in 2023-24, with 422 deaths being recorded in contrast to 448 in 22-23. Of the note of the annual report is over the last 3 years under Labor, and despite the increase of expenditure on family services, the per child spend in Queensland still remains far behind New South Wales and Victoria. In February of 2025, the Child Death Review Board tabled its annual report for 23-24. During this time period, the Child Death Review Board reviewed 70 cases, which was more than it received during the year. Despite this, as of 30 June 2024, there were still 65 cases awaiting review by the board. Of the cases examined by the CDRB, 56% involved domestic and family violence. In Queensland, the leading cause of death for children aged 10 to 17 is suicide, which represents 6 of the deaths reviewed by the CDRB. On the 13th of March, the committee held a public hearing with the Queensland Family and Child commissioners. During that hearing, the Principal Commissioner emphasised the value provided by the QFCC's review, as well as the importance of the Child Death Register and the work of the CDRB. The QFCC highlighted the significant changes anticipated following the implementation of the Child Safe Organisations Act 2024. According to the QFCC, the Act expanded the scope of responsibilities, increased its budgets from 12 million to 23 million, and grown to the full-time equivalent staff from 50 to 80. When questioned on progress regarding the protection of the mental health of children in Queensland, the Queensland Family and Child Commission advised that it anticipates several government initiatives and new announcements that would make positive differences. Specifically, the Commission mentioned the Christopher government's 12-month Staying on Track program as having a potential to change the situation of children leaving detention for the better. In summary, the Queensland Family Child Commission plays an important role in keeping children safe. Its work is maintaining the Child Death Register and hosting the CDRB is undeniably important. I commend this bill to the work. We brought to work. Thank you.
Yeah.